Hi, welcome back to Brave Talk, the podcast where we explore children building their courage by using evidence based strategies, compassion, and collaboration. I'm Dr. Melissa Giglio, clinical child psychologist who specializes in anxiety and selective mutism. Today, we have a special guest, pediatric OT, Lorena Maré.
Hi, everyone.
We're very excited to have her here today to really talk about how OT can be a supportive therapy for children with anxiety. It isn't something that we always think of as a first go to, but we have seen in our work together how helpful it can be. And I think we should start with diving into what exactly is OT for all those people who aren't quite sure what it is and are a little confused when their kid gets referred for it.
So it's a great question to start with because a lot of people don't know what occupational therapy is. So, in terms of working in the pediatric space, occupational therapy is defined by enabling independence. So, what we're working on is everyday occupations. So, for a child, that would include things like being able to play with a friend, being able to regulate their bodies and their minds, being able to complete their work at school. So that could be working on things like fine motor skills. So generally, we're enabling independence in some shape or form. So we're always looking at the functionality of what they're doing. But the areas that we're focusing on as an occupational therapist are fine motor skills. So this can include scissor skills, this include handwriting, hand strength, just a variety of different areas. We can also be looking at gross motor skills. So being able to play with our friends, that includes gross motor skills. So being able to climb on the playground, being able to balance along a balance beam, being able to catch a ball and play sports. And so we're looking at different types of gross motor skills. We work a lot with kids on visual perceptual skills. So being able to, for example, read something on a board and copy it, being able to scan for an item across the room. So again, functionality, I'm independent at getting myself dressed. So I'm going to scan the room, look for my socks and get them and collect them and put them on. And we also, on that note, look at self-care. So getting kids to do their own buttons, pull up their pants. We work on toileting skills. So there's quite a range of variety there as well. And last but definitely not least, we look at sensory processing for children. So this is a child's ability to self-regulate, and we look at all the different senses. So most people know the five senses, which will be things like taste, touch, smell, hearing, and sight. And then we also look at the vestibular system, the proprioceptive system, the interoception system. So a little bit more fancy. And all it means is a child is able to regulate themselves and be able to access all the other things in life when it comes to things like attention, being able to communicate. So all the other learning steps of the pyramid, but sensory integration is the foundation of that.
So basically, you're helping kids feel successful and confident with development and being kids in any facet in their life, which is school, social, just being able to grow and do more things on their own and feeling confident about it. I love that. That's why I think it's so important how it can really support the work that we do. No, as clinical psychologists, we usually refer for OT, usually for autism and ADHD and neurodevelopmental disorders that really need that boost. But you don't always hear about it for anxiety. Everything that you just talked about would really be so supportive for a child with anxiety as well. And we have had discussions before where we talked about how having time in the OT room working with you, how their anxiety feels lower when they're able to regulate their system more. So why don't we start with regulation and anxiety? Because we see the emotional side of the worries, the fear, the avoidance, the feeling unable to do things. But in those moments, their body's clearly working overtime. And that's what we're observing in these kids. We see that they're, have a racing heartbeat. We see that they're tense. Children with SM have a more flat affect, but so much might be going on inside. They may have upset stomach, those other psychosomatic kind of symptoms that they don't feel well. How can you help with that? How can OT be that supportive treatment?
So there's kind of two ways to support. One would be to first off kind of teach a child about these feelings and teach kind of what's coming up. So not only would you be working on that as well, but as an occupational therapist, we would talk through how not just how the feeling feels, but also what our body is doing. So we would start to look at things like body clues. When I'm feeling a little bit nervous, I start to get sweaty in my hands, my heart goes a little bit faster, all those things you just mentioned. But we would really talk them through in different scenarios. And we would use things like the zones of regulation to help us identify what zone we might be in. So I'm feeling jittery, I've got butterflies in my tummy, I'm sweaty palms, fast heart rate, I'm in the yellow zone. And then we talk about tools that we could use. So that's more of kind of a top down, allowing them to think about what that feeling might be and what tools we could access. But then on a much deeper level, we also work with them on the actual sensory integration part, because a lot of the times when kids have anxieties, they're potentially things happening from a sensory piece as well. So they might be overwhelmed in their system. They might be sensitive to different, often when there is anxiety, they're often sensitive to different sensory aspects. So for example, it could be noise, it could be, a room full of people, it can be bright lights, it could be things like that. Trying to desensitize that over time. A lot of the things we do as well is work with their body to allow their system to calm down, because it's very difficult for them to work on the skills when their body is in such a kind of fight or flight mode of I'm frozen, I'm not ready to work on anything else. So if we can relax the body and relax the mind a little bit more, then they're going to be able to access those key things a lot better. And the way we do that is working a lot with what we kind of call heavy work tools. So it's very grounding, it's very calming. It's the same way as an adult. If you're very, very anxious, you can go to a psychologist and you could do the work, but you're most likely also going to be doing something on a physical and sensory level. So you're most likely going to be meditating. You're going to be going into spaces where it's very calm and quiet. You're going to be getting massages. So essentially, we as adults do these things, but we forget about the kids needing that aspect as well. And so, us as OTs, we could be teaching parents how to do a deep pressure massage. So, prior to going to places, we're calming that nervous system down immediately. We could be considering what we call a sensory diet as well. So, throughout the day, having regular input that's very calming and grounding, so that the things don't build up and then a trigger or explosion kind of happens, but instead we're constantly feeding a little bit of calming input throughout the day. And so working with the parents to understand these are kind of the techniques, whether it's a deep pressure massage, whether it's when we're transitioning, doing animal walks instead of just a normal transition, because when we're doing animal walks, we're doing a lot of heavy work through the muscles and the joints, which again is very calming and grounding. Or we're going to get them to carry their own backpack, because again, that's heavy work and they're having to do the lifting and the work. So all those small little tools is going to allow them to that system to be more calm without them even realizing. And then, of course, when we work from that top up approach, we can then explain, these are the tools that make us feel better. And this is when we can access them. And this is also when we can advocate for ourselves and to use them. So, yeah.
So I love that because we're actually giving them the tools. And so much what we do is kind of that approach, teaching them how to approach things. And if they have more capacity to approach because you've calmed their system down, they can tolerate more, which then will help them habituate more. So it's this cycle that will keep continuing. And you're teaching them to have these. So with our selective mutism kids, they obviously don't speak right away in the room with you. But I do know that through your movements in different kind of activities, sometimes they will, when they're getting that input, be able to make more sounds and then actually use words and say they want more. Have you seen that a lot in your room with them? I know you're doing it with your movement and fun and different activities, not so much the conversation like we do in our room, but it's such an important piece. And I feel like they do come out more relaxed afterwards.
I think, yeah, I mean, I think that's kind of the beauty behind being an OT when working with us, because there's not the pressure necessarily of we have to have this conversation or this is kind of our out like our goal. My goal is just to calm them down. So for example, they come into the room and immediately it's just playful right away. They see a swing, they see an obstacle course or whatever it is. And right away, there's no pressure. There's just that ability to kind of calm down, relax. Let's see where this takes us. And then through the play and through the fact that they're starting to calm down in their system, then the words start to come out. And then obviously we start to engage with each other and then they want to talk more, which is great. So it's it's a very natural process in terms of the actual speaking in the end, which is really, really nice. But also it's really nice for parents or somebody else to see who might be an auntie or a parent who might be in the session or after the session, just let them know like, this is kind of how we approached it and we got the same outcome, but it's just through a different avenue.
It's actually even more spontaneous if you think of it, because it's really motivated by them, where What we do in session is to really shape how to help them feel successful and gain that confidence and be able to engage with more people. You're actually getting more of that spontaneous kind of verbalizations to you, saying what they like, what they don't like, and giving that input. So they're really connecting those two dots. We work with the overlearning, with the practice and support, but you can just see how these two would work so well together. And again, I think having the caregivers come in the room and see these things happen is so important for both of our work, because so much of what we get is like, oh, they don't do this or they won't do this. So much of the kind of criticism or kind of negativity around it, especially when we hear about they do when they're comfortable. But I do think it's so good for them to see that difference when they're with us and the why behind what we're both doing. Because you don't always think of, I'm sure parents don't always think about the importance of those types of exercises and movements that you are bringing into the room with them and having them do. And it is so important for their development and for their muscles and for their feedback. So much of what we do in session two is bring in some motor, because we've noticed that some of our kids are reluctant to engage in motor activities with other kids around when they're anxious. In OT, how do you integrate those practices so that that can generalize into other environments?
So you mean as in the motor aspect?
Yes.
Yeah. So to be honest, what we often, again, it's through play, but what we'll often do. So for example, I've got a case at the moment who is diagnosed with selective mutism. And one of the things we've noticed is he's really struggling with his everyday routine in the morning. So just getting dressed as an example, right? And there is some fine motor issues, but there's also a lot of hesitation around everyone's watching me get dressed, as you were saying, and that kind of pressure of we're under a time crunch, we have to get ready to school and everything else. And so at the moment in the sessions, we're working a lot again through play with things like therapy and having to find treasures inside to work on hand strength. And then we're working on grading the actual fine motor activity in terms of buttoning. So we're going from large buttons where we're putting together pizza to then smaller buttons where we're actually working it on ourselves. And we're just grading the activities to simplify it at first and then starting to bring it into the home environment. But at the start, again, having more time. So we're working on the skills and the motor aspects when it isn't the morning routine and we're having the pressure and all of that anxiety inducing environment situation. But instead, we're working on it first and foremost in an environment that is safe and fine and there's no rush. And then once we're successful at that, starting to transfer it more into the morning, but only bit by bit. So it's really about just grading it, breaking it down. Um, so yeah.
Just taking that time. I think we both agree that that rush only breeds more anxiety and also frustration. And having that time with you, or even having that time here, like no matter where we get in a session, it's progress because we're inching towards it, but we don't have that, oh, I'll just do it, or that frustration piece. We're really able to nurture and scaffold it to help them get there and in a playful way, which I think the key for both, as much as I'm a cognitive behavioral therapist, everything with kids is play. Like it has to be. And same with you, like you're generating new ideas and new games and working on skills that they actually need, things like even tossing and throwing or being able to down after they've been spinning or climbing. These are things that they might be hesitant to do or not feel so confident about. And you build that skill up.
Yeah, we do a lot of physical games for sure. Mm, And, that's through obstacle courses. That's through we're American Ninja Warrior and we have to careful because the floor is lava. And so everything is really fun and silly and it and yeah, there's no pressure. And if we fall, it's like, oops, that's fine. We've got, there's it's not a big deal. And so it's building the confidence because a lot of times it's just that confidence piece. And with practice, that confidence builds and then we can carry it over.
It's so great. I love that. So one thing that you created that we have actually incorporated into our camps and we use all the time is a program called Break It Kids. And it's something that I have found incredibly valuable because I really did notice, especially when we ran our intensives, we run an intensive program a few times a year, that when we would do anything with motor movement in a bigger group, so I'm always thinking about PE class or like going to an activity, our kids would freeze and they'd be really stiff. And so much of anxiety is front loading them so they feel successful with certain movements, especially when it comes to sports. But what you've created, I'm going to let you talk about what it is, has been so helpful in terms of just giving them something to do that's, motor based, also sensory based to help them regulate. Was super fun. So why don't you tell us a little bit about Break It Kids and so we can tell everybody about it.
Break It Kids is an immersive movement break that both my husband and I created during COVID. Um, and it is all about regulating students. So the idea behind it is there's a three-step structure that's based on sensory integration. And what we're essentially doing is we are priming the child to be ready for whatever is next. So what we often see is we either have, let's just say in a classroom, for example, you've got your sleepy kid maybe on one side, and you've got the kid who's hyperactive on the other side, and you've got everyone in between as well. So for a teacher, it's a lot. And same when we're running camps, right? They're coming in from one's just being rushed here, one's still half asleep, one's on a sugar high from cereal, who knows? And so what you're getting is you're getting a variety of students. And essentially what we're doing at the beginning of our movement break, unlike others, which is just moving, what we're doing here is at the beginning, we do what we call fired up. So it's high intensity movement. So we do movements like sprinting and jumping and very loud and active. So think of like a hit session. It's really full on. We're getting the heart rate on up to 140, 160, as high as possible, pretty much. And we are pumping lots of blood flow through the muscles and brain and oxygen and everything else. And same with the beats, the music. So the beats per minute are 140 to 160 to match the heart rate. And so everyone is essentially going into a high alert state. So if we imagine that green zone, which is a very regulated state, and being ready for whatever is next, that your next activity, we're getting everyone up really nice and high. Then that's where you don't want to leave them. So that's why it's really important to never stop, skip, anything like that. Follow the whole Break It Kids. And then in the second part, we are doing what's called Focus It. So this is where we're doing movements that require a bit more attention. So we're doing movements where we're crossing the midline, where we have to follow a sequence. So we're doing memory, working memory. We're doing balancing on one leg. So it draws their attention in, but it's still quite active. So the music is still, again, 140 to 160. But for this sleepy kid, we were waking them up in the first part, and now we're drawing their attention inwards. For the hyper kid, we release their energy, especially the excess energy, and now we're drawing them in. So everyone is really benefiting from this. But again, we're not quite calm and ready for what's next yet. So then the last part is what we call the cool it. And the cool it, what we're doing in this part is this is where we're really starting to come down into that green zone. So this is where we're doing things like deep pressure massage. We are doing things like breathing techniques, meditation, and that allows us to then be ready for whatever is next. Now, through that three-step structure, it's 10 minutes for a reason. So it's a little bit longer than most movement breaks because it is site-spaced, and we need at least 10 minutes to have outputs. Just like anything in life, we want that quick and easy, but we need a little bit more investment to really get the output. This allows us to be regulated for up to 2 hours afterwards, and it allows a student to really go through that circuit to be primed. And the best part is that kids really, really enjoy it because, again, we're being playful. We are going, for example, into Monster Hunt, and we have to find all the monsters and bring them back into their world, or we're going on a pirate adventure. So each one has a different theme. And so the kids really, really love it, especially when they love something like dinosaurs. They love Dino Island. And the beauty behind all of that as well, from an OT perspective, is when they love something and they want to repeat that same episode, let's just say dinosaurs, because every boy likes, well, most boys like dinosaurs. Then they're going to go back to Dino Island, which means they're repeating the same exercise. And some of our exercises are a bit more complex. So when we're crossing midline, and let's say we've got an exercise where we're doing star jumps, they're doing that over and over again, which means from a motor perspective, they're getting better at their motor skills. So much beauty behind that. And because the adventures are 10 minutes and they're quite long, it means they kind of forget what happens in between. It's like a TV show for them. So they want to go back and they want to watch it because they kind of forgot something in the middle potentially. But yeah, we have, I think, 36 episodes now, plus another 17 SDG type episodes, which are the Sustainable Development Goals. And we have 17 meditation series. So we've got quite a range of different episodes at this point. But all of them are all about just allowing the child to be regulated and ready for what's next. Because, as an adult, you have so many tools in life to be regulated, and we can access them. We go to the gym, we chew gum, we meditate, we drink a glass of wine, we do all the things that we we're constantly regulating ourselves in one way or another, listen to music. But we don't really allow kids to have a toolbox. We try, but it's kind of on our terms. Whereas Break It Kids was all about allowing a very easy click and play, anytime, anywhere tool that a kid can say, Mom and dad, teacher, whoever it is, I need a break. I need Break It Kids, and I'm going to feel better afterwards. And I know that. I don't know why, but it makes me feel better afterwards. And if they see me, they'll understand why. But if they don't, then they have just something that works for them.
I just keep thinking in class though how nice it is to like, when they do different motor breaks, how they don't have that focus it or they don't have that cool it at the end. You have the kids who are all hyped up and then you're redirecting, redirecting, redirecting. And yes, that break might have been shorter, but you're spending so much time redirecting as opposed to going through a series like this where we really can transition to sitting down, getting ready to work. And for anxious kids, it could be, I finally feel calm now. Maybe I can give it a go. I can maybe read to my partner, or I can start writing and taking that risk of getting that pen to paper and putting my ideas out there. There's so many benefits, I think, for everyone in the class. And the more regulated the class is, the better the class will function, the more that they'll be able to get done throughout the day, which is, we want the kids to, have access to learning with the motor, with the breaks, with the peer time too. All of those things are so
And I
good.
think a
Totally.
lot of the times, when it comes to movement breaks, a lot of teachers will say, well, they've just had recess, for example. Why is everyone all over the place? And it's about because movement, it depends what type of movement. And it's so important to know that because a kid who, let's just say a kid at recess who was on the jungle gym the whole time climbing is going to be a lot more regulated than a kid who was running around in circles playing soccer because certain movement activates and alerts and certain movement is very calming. And so that's why Break It Kids is so important instead of just an average movement break because the movement is very specific and every movement might just look like it's fun and it's just your typical movement, but there's a reason behind it and there's science behind it. And so being able to, as you say, have the fired up, have the focus, have the cool it allows the child to be calm afterwards and you don't have that high.
Yeah, I mean, that's what we want in the classroom. We want in that just right zone to be able to sit and listen and, access the learning and also be able to kind of acquire those skills and then show it in the classroom too. So I think it's great for everybody. And you don't always know what kids are doing at recess too. Some kids aren't moving as much and getting as much movement. From a health perspective, because, especially with all the disorders that we support, children with different difficulties, we always talk about, the health of the diet, the value of sleep and the importance of it, getting adequate sleep, but also about exercise. And some of it, I think different cultures have different priorities in terms of exercise and how they view even engaging in different sports and things. From your perspective, what is the best for kids in terms of what they should be getting? Let's say let's start with like toddlers and then let's go to early primary. And like, I think that's something that, often isn't discussed is like, what is the right amount generally? I know some kids will let you know when they need more, but like the general consensus of what should be the minimum that kids should be doing.
So for me, if you're looking, for example, at a toddler, I'd say the bare minimum would be 2 hours. They need a lot of activity. That's really my bare minimum. And ideally outside. So it's really important that they're digging in the dirt, that they're climbing the tree, because something like just running around in the house, you're not going to get the benefits of having to motor plan around, let's say, a tree branch or the roots of a tree and possibly tripping and figuring all that out. So outside play, but that continues. So that outside, I would say outside play all the way up. But yeah, 2 hours, I feel like even with the older ones, like there's so much when it comes to, even though they're getting older and they might not necessarily have to be outside, it's from a regulation piece. They do need to still be outside. They've been working really hard at school. They've been, now again, realistically, 2 hours is going to be a bit more tricky, but it's like, can we get, 30 minutes in the morning? Can we get 30 minutes in the playground at school? And then can we get another hour when they get home or an hour in sports? So I think when they're older, they can definitely do it in sports, but I think sports is a priority. Like there's so many pieces to sports that are so important to development, whether it's the motor piece, whether it's the problem solving, whether it's the social skills, whether it's the being able to cope with losing and winning, all these things. So there's so much in sports that's like an absolute must. And when it comes to kids, like I often say that are seeing OT, please as well keep the sports going. Don't try to choose between me or sports. Try to keep both as much as possible. But what I do look at sometimes from a confidence perspective is whether or not your child, if there is a lot of anxiety going on and if they are very behind on motor skills, let's say they're in a 10th percentile or something, then it's considering, can we do more one-to-one sports? So again, we're gaining the confidence, the activities being graded for us, and then we can move on to team sports later on, or focusing on the type of sport. So if hand-eye coordination is really, really challenging, can we have one sport that is focusing on that, but can we also have another sports that's just boosting confidence in general and working on the other skills? So it's very dependent on the child in that regard, but sports is a must. And with the sports also comes the sleep. The sleep is so, so, so important.
Of everything.
No screen
Yes.
time 2 hours before bed. We don't want, for the child, we're talking early bedtime, toddlers, 7 p.m. to 7 a.m. They need to be sleeping. And actually, still in primary, they really, really need that sleep because, again, we can't expect them to be regulated or to get the most out of the day if they're not sleeping the same way as us. We're going to be more easily triggered, more frustrated, less tolerance, all of that, both as an adult and a child, if we're not sleeping as much. So, yeah, both are extremely important.
That's so true. And I think, especially for the anxiety related to sports too, I think what's important is your kid doesn't have to be super coordinated to participate, but they might need some extra help from you as the caregiver outside of that sport one on one to help them gain more of that confidence over time. It's quality time, it's reps, it's trying to do it when they're not feeling the pressure of the coach being there telling them what to do or the other kids. There might always be this kid who is amazing with things who just kind of gets it right away. But you do see lots of improvement with the kids you work with, like kids who might not have great hand-eye coordination can grow leaps and bounds, correct?
100%. Again, it's the practice and the grading it and again making it playful, right? So thinking of different ways, we're working on hand-eye coordination, but why can't it one day be from bowling to cornhole to, I think that's what
Yeah.
it's called,
Yeah.
to basketball or whatever it is. So changing it up and yeah, and making it fun and making it oftentimes without the pressure, without the win or the loss, but just,
Yeah.
you know, can we as a team work together to achieve a target? So you and I are on the same team and we're trying to get points against dad or whatever it is. So yeah, it's definitely just the getting the reps in for sure.
Yes, I think that's so important because I find that a lot of parents are, especially with the anxious little ones I work with, like, oh, they didn't like it, they didn't want to join, and so much of it is they're observing, and they're not sure how they feel about it yet, and they haven't given it a go. And I tell families, if you signed up for it, you should continue to go because you are removing the possibility that they'll feel ready one day and go in and participate. And it might not be the first session, it might not be the 10th session. Sometimes they just have to take it in and kind of understand what's going to happen. You can practice outside of the sessions, and then they could have that opportunity where they one day just get up and join, and they feel so good about themselves. But if you just follow that first day where they seem like they didn't want to separate or they didn't want to go in, and then you say, oh, they didn't like it, we're not going to do it again. Now they've missed the opportunity to practice. They haven't had the success of trying something new. We've just decided they don't like something. I mean, so many of our kids don't like vegetables at first, or certain fruits, or certain textures of food. And like, it's one of those things we have to keep trying to build up this openness of possibility of like, I can like something if I keep trying, or I can be good at a sport, or I can be feel confident in school. These are also related with this just open-mindedness of like, I can give anything a go and it will get easier with
But
time.
it's even comparing it to ourselves, comparing it to school. So for us, we might not like an activity right away, or we might not, if we've just, let's say, changed jobs, we might not like the new job right away, or we've just moved houses. We might not like the new place right away, but it can take time to like, and the same thing with school, right? Kids often, they have that separation piece when it comes to school. The first few weeks they're struggling, they're finding the routine, they're trying to understand how it all works. And then once they feel safe and they understand what's kind of expected, then they start to really enjoy it. So in that way, in terms of school and sports, it's quite an easy comparison because you often find kids are like, no, I don't want to go to school. And then suddenly they're like, I love school. And it's the same often with sports. Kind of understanding the expectation, the routines, things like that as well.
So important for them. But I think I love that you're focusing on toddlers being able to start doing activities and getting that movement in. And correct me if I'm wrong, but toddlers activity can also be walking to go do something, can count as time outside and exploring and running. Like, it doesn't have to be like, we're here now, clock starts
No,
2
yes.
hours. It just incorporating movement throughout the day with transition, letting them walk, letting them, like, run from tree to tree, or, let go of your hand and run a little bit, or and learn how to jump. Like, all of these are movements that count for that exercise and that exploration. And it doesn't have to be this, I signed up for a class and it's 50 minutes.
No, and actually I'm almost the opposite. I think when they're little, like you don't need all these classes.
Yep.
Actually, the more they can just go wild and free roam, kind of the better, because the more they tend to actually explore. But even with my little one, as an example, like I will often do obstacle courses at home. So it's kind of like when I notice the zoomies are happening, I'm like, oh, we're going somewhere. So let me just nip this in the bud right away. So we'll set up, pillow cushions, nothing fancy, pillow cushions, stepping stones, and then next thing I know, she's feeding the animals because she's bringing the food from one side over to the animals on the other side. Great. And suddenly I've got a child who's getting the heavy work, who's getting regulated, and then she's ready for dinner time before she goes absolutely crazy. In that transition phase between we've just played on the playground and she might still be on a little bit of a full of excitement, and then she's coming home and we've got dinner time, but that 10-minute waiting phase can sometimes go a bit wild. So that's an easy way where you can integrate movement. It doesn't have to be fancy. But yes, definitely movement in any shape or form is fantastic for them, because the more we allow them to, even inversion. So a lot of kids, a lot of times parents will look at me, especially with my toddler, and they'll be like, "Oh, it's dangerous, it's dirty," or it's, whatever it is. Obviously, as an OT, there's a lot that I know that they might not know. But, I'm often tossing my girl in all different directions. I'm often, she'll be upside down and I'll leave her there, or she'll crawl in weird positions, or because she's just exploring what her body feels like and what the movement feels like. And, oh, if I put my head this way and I put my arm that way, what does my body do? Suddenly I've done a forward roll, and it's like, okay, well, and that's them motor planning, that's them learning through doing. And so I think as a parent, often the more we actually step back a little bit and trust that, they've got to figure it out a little bit and just explore, the better. And sometimes as parents, we're too quick to kind of interrupt those little moments, because it's very easy to, because we'll be like, what are you doing? Like, can you just walk normal? Or why are you walking on the little beam or edge? And it's like, just walk on the sidewalk. But actually, that's a balance beam for them. That's an opportunity. And if we let them, great, and we just encourage it. And that's when, I really try to remember my OT side of things rather than my mom side of things, of being like, just walk on the sidewalk. But instead I'm like, great, balancing on the side of the walk here, side of the beam, or whatever it is. So yeah, just trying not to step in and correcting all the time, and just encouraging their wild, interesting, wonderful ways of exploring.
So giving them that calm confidence, that belief that you're there, you're approving of what they're doing, you're letting them explore. I think the biggest thing we both focus on is not rushing, and letting them kind of fumble, and working on our own distress tolerance to help them build their distress tolerance and their capability, so that they feel more brave and courageous in general.
Totally. And being there, but not being there. So
Yes.
being
Yes.
exactly as you say, just allowing them to have that space, because that's what builds their confidence. Yeah, 100%.
Beautiful. Well, thank you so much for joining Brave Talk today. This is so helpful. I feel like I am always asking you questions, and trying to incorporate more movement into our work. Just I feel like it's so important. I just focus on the talking and decreasing the anxiety. I'm missing a big component. And I've just seen the benefits of, what you're doing there. And I do love Break a Kid. So I'll definitely share that in the notes too, just because it's something I use. I think it's something every school should incorporate. I love the science behind it. So thank you so much for being here
Thank you
today.
for having me.
Of course.
Bye.
Bye.